What is biopsy? A biopsy is a medical procedure that involves the removal of a small sample of tissue or cells from the body for examination under a microscope. It is commonly performed to diagnose or rule out various medical conditions, including cancer, infections, inflammatory diseases, and other abnormalities. Types of biopsy. There are several different types of biopsies, each tailored to the specific area of the body being examined. 1. Needle biopsy. This type of biopsy involves the insertion of a thin needle into the targeted area to extract a tissue sample. 1. It can be performed using various imaging techniques, such as ultrasound, CT scan, or MRI, to guide the needle to the precise location. 2. Incisional biopsy. In an incisional biopsy, a small piece of the abnormal tissue is surgically removed for examination. 2. This type of biopsy is typically performed when the abnormality is large or when it is not possible to remove the entire area. 3. Excisional biopsy. An excisional biopsy involves the complete removal of the abnormal tissue or tumor. 3. This type of biopsy is often performed when the abnormality is small and easily accessible. 4. Endoscopic biopsy. Endoscopic biopsies are performed using a long, flexible tube with a camera and a small cutting tool at the end. 4. The tube is inserted through a natural opening or a small incision to reach the affected area and collect tissue samples. 5. Bone marrow biopsy. This type of biopsy involves the extraction of a small amount of bone marrow from the hip bone or breastbone. 5. It is commonly used to diagnose blood disorders, such as leukemia or lymphoma. Why is biopsy performed? Biopsies are performed for various reasons, including 1. Diagnosis. Biopsies are often used to determine the presence or absence of cancer or other diseases. 1. The examination of the tissue sample under a microscope can provide valuable information about the nature and severity of the condition. 2. Staging. In cancer cases, biopsies can help determine the stage of the disease, which is crucial for planning appropriate treatment strategies. 3. Monitoring treatment. Biopsies may be performed during or after treatment to assess the effectiveness of therapies, such as chemotherapy or radiation. 4. Identifying infections. Biopsies can help identify the presence of infectious agents, such as bacteria, viruses, or fungi, in the affected tissue. 5. Evaluating organ function. Biopsies can provide insights into the functioning of organs, such as the liver or kidneys, and help diagnose conditions like cirrhosis or kidney disease. The biopsy procedure. The biopsy procedure typically involves the following steps. 1. Preparation. Before the biopsy, the patient may be asked to avoid certain medications, fasting, or follow specific instructions depending on the type of biopsy being performed. 2. Anesthesia. Local anesthesia is usually administered to numb the area where the biopsy will be performed. 2. In some cases, general anesthesia may be used. 3. Tissue extraction. The healthcare provider will carefully extract the tissue sample using the chosen biopsy method. 3. The procedure may involve a needle, a small incision, or an endoscope. 4. Post-procedure care. After the biopsy, the patient may experience mild discomfort, bleeding, or bruising at the biopsy site. 4. The healthcare provider will provide instructions on how to care for the site and manage any potential complications. 5. Pathology examination. The tissue sample is sent to a laboratory, where it is examined by a pathologist under a microscope. 5. The pathologist will analyze the sample and provide a detailed report to the healthcare provider. Conclusion. A biopsy is a crucial medical procedure used to diagnose and monitor various conditions. It involves the removal of a small sample of tissue or cells for examination under a microscope. Biopsies can provide valuable information about the presence of cancer, infections, inflammatory diseases, and other abnormalities. The procedure can be performed using different techniques depending on the area of the body being examined. If you have any concerns or need a biopsy, it is important to consult with a qualified healthcare professional. For more information or to schedule a consultation with Dr. Karan Chopra, a board-certified plastic and reconstructive surgeon, visit here. FAQs about biopsy. What is a biopsy? A biopsy is a medical procedure in which a small sample of tissue or cells is taken from the body for examination and analysis. It is commonly used to diagnose various medical conditions, including cancer. Add image. How is a biopsy performed? The procedure for a biopsy can vary depending on the specific case and the area of the body being examined. Generally, a healthcare professional will use a needle or a surgical instrument to extract the tissue or cells from the body. The sample is then sent to a laboratory for further analysis. Add image. Why is a biopsy necessary? A biopsy is necessary to determine the presence of abnormal cells or tissues in the body. It helps in diagnosing various medical conditions, such as cancer, infections, autoimmune diseases, and other disorders. The results of a biopsy can provide valuable information for treatment planning and management.